Avoid dialysis. 8 warning signs of kidney failure. Tests you must do. You could be living with end-stage kidney disease and still think you're perfectly fine. So, watch this video as soon as possible, before dialysis becomes your only option. Now, do you eat less, but assume it's just stress? Do you wake up twice a night to use the bathroom, but brush it off as normal aging? You feel tired all the time, but blame it on your job, your sleep, or your busy life. And yet, your kidneys may already be failing. Right now, more than 808,000 people in the U.S. are living with end-stage kidney disease, or ESKD for short, also known as kidney failure. Once you reach this stage, there are only 2 ways to survive: a kidney transplant or dialysis. There's no third option. But here's the harsh truth. Over 100,000 Americans are currently on transplant waiting lists, and 87% of them are waiting for a kidney. Around 70% of patients with ESKD rely on dialysis to stay alive, and this can cost no less than $40,000 per patient per year. So why don't people catch it earlier? Because kidney failure rarely announces itself. It creeps in quietly. Patients often don't notice any change in their kidneys or urine. You might not see differences in the volume, color, or smell of your urine. Some people start waking up more often to urinate at night, but that isn't an obvious red flag. The sooner you detect ESKD, the better your chances of managing it and surviving it. In this video, we'll walk you through the subtle signs, the silent symptoms, and the simple but essential tests your doctor may run, so you'll know exactly what to watch for before it's too late. Just so you know, everything in this video is carefully researched and put together by real people, double-checked by actual experts, and kept bias-free. What signs and symptoms imply severe kidney disease? When your kidneys start to struggle, your body often sends signals that something isn't quite right. These signals or symptoms can feel overwhelming, especially if you're not sure what they mean. By recognizing them early, you can take steps to talk with your doctor and find ways to feel better, day by day. Let's walk through 8 common signs of severe kidney disease, explained in a way that's clear and practical, so you can feel more confident about what's happening and what you can do about it. 8. Fatigue. Feeling constantly tired is something many people with serious kidney disease go through. When your kidneys aren't working well, they can't clear out the toxins and waste that buildup in your blood, leaving you drained. Your kidneys also produce less of a hormone called erythropoietin, which helps your body make red blood cells. When your body makes fewer red blood cells, it leads to anemia, making you feel even more exhausted. If you have kidney disease, along with conditions like diabetes, high blood pressure, a past heart attack, depression, or trouble sleeping, you might feel extra worn out. Everyday tasks, like climbing stairs or even getting through your morning routine, can start to feel like a chore. The good news? People with kidney failure who stay active often notice their tiredness gets better. Gentle movement, like a short walk or stretching, can make a real difference. Some doctors prescribe medications called erythropoiesis-stimulating agents to help with anemia in severe kidney disease, though their ability to ease tiredness is still debated. Always check with your doctor to find what works best for you. 7. Muscle cramps. Painful muscle cramps often trouble those with advanced kidney disease. These sudden, tight spasms, especially in your legs, can catch you off guard. They happen when the balance of electrolytes in your blood, like calcium, potassium, or magnesium, gets out of whack. Leg cramps often happen during dialysis when your blood becomes too alkaline, a condition called alkalosis. When your blood's alkalinity throws off your electrolyte balance, it can trigger muscle cramps. After dialysis, low magnesium levels in your blood, known as hypomagnesemia, can also cause muscle cramps. Sometimes, potassium levels drop too low, a condition called hypokalemia, which can come from vomiting, diarrhea, certain medications, or dialysis itself. When your potassium levels drop too low, it can also bring on painful muscle cramps. The good news is, there are ways to ease this discomfort. Adding magnesium to the dialysis fluid can help ease muscle cramps for those with severe kidney disease. Your doctor might also tweak your medications to keep your electrolytes in balance, helping to keep those cramps at bay. And hey, if this feels helpful so far, let us know you're out there by tapping that like button. It tells us to keep making content just like this. Now you might be thinking, I don't have cramps, so I must be fine. But here's the thing. Kidney disease doesn't always start with visible symptoms. The next signs? They're even more subtle and often mistaken for something else. 6. Loss of appetite and eating less. It's not uncommon to lose your appetite when dealing with advanced kidney disease. When toxins and waste build up in your blood, you might find yourself less interested in food. This can start even in the earlier stages of kidney disease, but as things progress, you may notice you're eating even less. Things like mouth or stomach issues, dialysis, or feeling down can also make you less hungry when you have kidney disease. If you're dealing with both diabetes and kidney disease, you're more likely to lose your appetite. Over time, diabetes can affect the nerves that control how your stomach empties, a condition called diabetic gastroparesis. This can make you feel full even when you haven't eaten much, because food moves through your stomach more slowly. Eating might even lead to nausea, vomiting, or discomfort in your belly. Not getting enough nutrition can make kidney disease harder to manage, so it's really important to follow your kidney specialist's advice on what to eat. Your doctor might suggest medications like magistral acetate to help boost your appetite. If you're taking these, your doctor will keep an eye on side effects like fluid buildup, weight gain, or high blood sugar to keep you safe. 5. Itching. Persistent itching, often called pruritus, is something many people with severe kidney disease experience. More than 40% of those on dialysis deal with this frustrating sensation, and for some, it's bad enough to keep them up at night. The exact reasons for itching aren't fully clear, but it's likely due to more inflammatory substances and immune cells in your blood, an imbalance in opioid receptors, and a buildup of toxins and electrolytes. To help with itching, your doctor might adjust your dialysis settings or suggest treatments like gabapentin, pregabalin, phototherapy, or medications that target opioid receptors. These options can make a big difference, helping you feel more comfortable in your own skin. Now that might sound like a small problem, just a bit of itching. But up next are symptoms that affect your breathing, memory, and even your brain. If you felt off lately, pay close attention. 4. Shortness of breath. Feeling like you can't catch your breath can be frightening. This sensation, known as dyspnea, is a serious sign of advanced kidney disease and can have several causes. When your kidneys aren't working well, imbalances in fluid, electrolytes, or proteins can lead to extra water building up in your lungs, a condition called pulmonary edema, which makes breathing feel harder. Scarring or high blood pressure in the lungs can also contribute to this struggle. Anemia, which often comes with kidney disease, can make it hard to breathe because your body isn't getting enough oxygen. Another cause is when you're malnourished and inflammation is high with kidney disease. Toxins build up in your blood, causing a condition called protein energy wasting syndrome. This can weaken your muscles, including those you use to breathe, making every breath feel like more effort. The best approach is to work with your doctor to manage these causes, often with respiratory support or treatments tailored to what's causing your shortness of breath. 3. Memory loss, confusion, dementia. When your kidneys are struggling with severe disease, you might notice changes in how your mind works. It could be trouble focusing, forgetting things, finding it hard to learn new tasks, making decisions, or even feeling confused. In some cases, these changes can feel like dementia. These challenges happen because waste products build up in your blood, which can cloud your thinking and affect how your brain functions. Damage to blood vessels in the brain from low oxygen levels can also play a role. Feeling low on energy due to anemia, struggling with depression, or having trouble sleeping can also affect how your brain works. The good news is there are ways to help. Keeping your blood pressure well managed can lower the chances of mild memory or thinking problems. People who get a kidney transplant often find their memory improves after the surgery. If you're curious about the research behind this, we've included a link to the studies in our description box. 2. Urine-like breath, abnormal taste. Sometimes, severe kidney disease can cause your breath to have a urine-like smell, a condition called uremic fever. This happens when your kidneys can't filter waste properly, letting it build up in your blood. High levels of ammonia in your blood can cause a distinct urine-like smell on your breath. You might also notice an odd or metallic taste in your mouth, known as dysgeusia. This can come from changes in the amount, flow, or acidity of your saliva. Imbalances in your body's fluids, electrolytes, or a buildup of toxins can also lead to an unusual or metallic taste in your mouth. A simple way to tackle this is by using a bicarbonate mouthwash, which can help get rid of the unpleasant taste caused by waste buildup in your body. Poor oral hygiene is common for those with severe kidney disease, so it's a good idea to visit your dentist to check on your mouth's health. A quick dental checkup can go a long way. 1. Skin changes. Your skin might tell a story about what's happening inside your body when you have severe kidney disease. About 40% of people with this condition notice their skin looking pale or discolored, often because of anemia. Others might see darker patches, called hyperpigmentation, due to changes in hormone levels. If you're noticing darker patches on your skin, applying sunscreen can help keep it from getting worse. The buildup of substances that give urine its yellow color can also give your skin a yellowish tint. Very dry skin, known as xerosis, is another common issue, though we don't fully understand why it happens. It's likely because the glands in your skin that produce oil and sweat aren't working as well, leaving your skin dehydrated. Dry skin can be eased by washing your hands, showering, or bathing less often. Using moisturizing lotions and avoiding fabrics that irritate your skin can also help. If your skin changes feel overwhelming, a dermatologist can offer tailored advice to make you feel more comfortable and confident. If any of these signs sound familiar, don't wait, because by the time symptoms show up, your kidneys could already be in serious trouble. But here's the good news. There are simple, affordable tests your doctor can run to catch kidney failure before it takes over. Let me show you how they work. Tests to detect kidney disease. Catching kidney disease early can make a big difference in managing it. Your doctor has several tests to check how your kidneys are doing and spot problems before they get worse. One key test measures creatinine, a waste product in your blood. The GFR shows how well your kidneys are cleaning your blood. If your creatinine levels are high and your GFR stays low, your doctor will likely diagnose you with kidney disease. Another test checks for urea nitrogen in your blood. High levels of urea nitrogen in your blood can mean your kidneys aren't clearing waste as they should. Your doctor might also test your urine for protein, a condition called proteinuria. Healthy kidneys let only a tiny amount of protein into your urine, so if there's more protein than normal, it's a sign your kidneys aren't working properly. An ultrasound, which uses sound waves to create pictures of your kidneys, is another helpful tool. It can spot structural issues or problems with blood flow to your kidneys, helping identify if you're at risk for kidney disease. These tests are simple steps that can give you and your doctor the information needed to take care of your kidneys. Treatment options for kidney disease. Living with severe kidney disease can feel like a heavy burden, but there are ways to manage it that can help you feel better and live more comfortably. The right treatment depends on your specific situation and how far the disease has progressed. Let's walk through 4 main options that can make a real difference, explained in a way that's clear and practical for you or your loved ones. 1. Medications. Medications play a big role in managing kidney disease, especially when it's severe. They help ease symptoms and prevent complications from getting worse. For example, some medications keep your blood pressure under control, which is key for protecting your kidneys. Others, called diuretics, help you urinate more to reduce extra fluid buildup in your body. There are also medications to treat anemia, which can leave you feeling tired, and others to keep your blood sugar steady if you have diabetes. Medications that control blood sugar help keep levels steady for those with diabetes. Your doctor will tailor these to your needs so you can feel more like yourself day to day. 2. Kidney transplant. For many, a kidney transplant is the best option for severe kidney disease. It involves replacing a damaged kidney with a healthy one from a donor, freeing you from the need for dialysis. It involves finding a matching donor, undergoing surgery, and taking lifelong medications to prevent your body from rejecting the new kidney. This path can offer a longer life and a better quality of life compared to staying on dialysis. Kidney transplants are linked to fewer heart-related problems compared to dialysis. While it's a big step that requires careful planning and ongoing care, it can bring a sense of hope and a chance to reclaim some normalcy. 3. Dialysis. When kidney disease reaches its final stage and lifestyle changes or medications aren't enough, dialysis becomes a lifeline. Dialysis is needed in the final stage of kidney disease when your kidneys can no longer clean waste from your blood effectively. Dialysis acts as a substitute for your kidneys, using artificial methods to filter waste from your blood. There are two main types. Hemodialysis, one type of dialysis, uses a machine to clean waste from your blood outside your body. This usually happens at a clinic a few times a week. The other type, peritoneal dialysis, uses a special fluid placed in your belly through a tube where your body's own membrane filters out waste. Peritoneal dialysis gives you more comfort and freedom, letting you do it at home overnight without costly machines. Both options help you keep going, and your doctor can help you choose what fits your life best. 4. Lifestyle changes. Small changes in how you live and eat can make a huge difference when you have severe kidney disease. Eating a kidney-friendly diet is key to avoiding malnutrition, reducing waste buildup, slowing kidney disease, and preventing complications. Your doctor will guide you on what's best, so talk to them about how much protein, salt, potassium, fluids, and phosphate you should have for your kidney condition. Staying active is another powerful step. Regular exercise can improve your blood pressure, energy levels, heart health, muscle strength, and more. Even gentle activities like walking or stretching can lift your spirits and strength. Stopping smoking can really help your health, as smokers face a higher chance of developing severe kidney disease than non-smokers. These changes take effort, but they're worth it for how much better you can feel. Comparing treatment options for kidney disease. We've explored several ways to manage kidney disease, each with its own role. Medications help tackle symptoms and complications early on, but they can't fully replace kidney function when the disease is severe. Dialysis steps in when your kidneys can't filter waste anymore, acting as a temporary bridge. A kidney transplant offers a more lasting solution, but comes with the challenges of surgery and lifelong care. Lifestyle changes stand out as the safest, most lasting way to slow kidney disease and avoid complications. These changes can also help you manage and prevent issues like diabetes, high blood pressure, heart disease, and obesity, which are linked to kidney disease. Combining these approaches, eating well, staying active, managing fluids, and controlling risk factors like blood pressure and diabetes, can slow the disease and improve your life. Regular check-ins with your kidney specialist will keep you on the right track, ensuring you get the care that's best for you. Conclusion. We've reached the end of our journey today. Thank you for taking the time to learn about kidney disease with us. The key takeaway is that understanding the signs and treatment options for severe kidney disease can truly change how you live with it. Spotting symptoms like tiredness, itching, swelling, or shortness of breath early and working with your doctor can make a big difference. Whether it's through medications, dialysis, a transplant, or simple changes like eating better or moving more, every step you take matters. Staying close to your kidney specialist and following their guidance will empower you to manage this condition with confidence. We hope this information brings clarity and hope to you or your loved ones as you navigate kidney disease. We want to thank you for being here, for listening, for having the courage to embark on this journey of discovering what truly benefits your health. A journey that isn't easy, but is worth more than anything else. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Concerned about kidney disease? Your kidneys might need a natural boost. Check out our next video about the top 5 fruits that can help cleanse your kidneys naturally. We'll share evidence-based tips to maximize their benefits. See you there, stay informed, stay healthy.